Hi everyone, today I have Chen here with us, who is a clinical psychologist and the director of Mind Body Heart Psychology. Mind Body Heart Psychology is a bilingual private practice here in Melbourne, and they're also one of the practice partners on our Shapes and Sounds Asian Mental Health Practitioner list. So thank you so much for joining me today, Chen.
Thank you, Marcus. And I have to say, I'm very honored to be a practice partner with Shapes and Sounds. And I think from our perspective, it's just a great initiative. And there isn't something like that where, it's not, I mean, we have something that for Chinese mental health professional,
Mhm.
Chinese psychologists, but really not something for the whole Asian community.
Yeah, definitely. That sounds great. Okay, so I think we'll just kind of start with asking about like your journey into psychology and sort of like how you started mind, body, heart psychology. Like, could you tell us a little bit about that?
Sure. So I actually never set out to run a group practice. In fact, I've always told myself that's something that I would not do. Um,
Really?
yes, because we know this is probably not a very easily profitable business.
Mm,
Um, However, so initially I was always working with a group practice. I learned a lot. And then later on, I had just an opportunity to see a couple clients privately on myself.
yeah.
So I had to set up the software, set up the company, or just for that couple of clients. And then it just grew more and more. And then again, a coincidence that I met Summer, so another clinical psychologist at our practice.
Okay. Yep.
And I thought, oh, why don't we partner up? Because at that time I already had referrals more than I could take.
Hmm.
And she said yes. So I thought, okay, this is not a good practice because it's just two of us. And then I think more and more people started showing interest. And I also noticed there's actually a really huge demand met in the Chinese community looking for Chinese speaking psychologists and counselors uh,
Mm,
for all age groups. And then there were more referrals than two of us could take. So a third person came on board. And as we have more and more people consulting at Mind Body Heart Psychology, we realized that it's also great that we have a team with diverse skills, specialties, backgrounds, and we now have team who speak not just Mandarin but Cantonese and
hmm.
Portuguese,
Mm.
because clients' needs are varied,
Yeah,
presentations are
definitely.
varied. So different personalities, different expertise, just offering more choices for clients. So this is how it just grew bigger and bigger with no intention. So unlike
Yeah.
other entrepreneur story you've heard, I
Hmm.
have no intention.
Yeah.
Everything, okay, let's find a room because we have one more person.
Yeah. It just
Let's,
kind of grew
let's
out
do
of the demand.
yeah, let's do a fit out
Yeah.
now because we don't have enough room. So everything sort of just was very nimble
Mm,
as our demands increase and as more people join us.
hmm.
Now
Yeah.
we have
Wow, that sounds so cool. But yeah, so you kind of mentioned having all these different skills and like practitioners who like practice different things. Like could you kind of talk about what kind of services you offer?
Mm. Sure. So the majority of our clients look for treatment,
Mm,
therapy, or at the moment we also have art therapy, couple therapy, psychosexual therapy.
hmm.
So we have a variety of demands in treatment therapy. Um, this year, in particular, we're noticing an increasing demand for people looking for psychological assessment and
Okay.
diagnosis for university special consideration for work
Mm,
purpose. We also now have a couple of lawyers that are continuously referring to us for TAC and work
yeah.
cover. And many of these clients chose us because either they wanted specifically to use a different language for their therapy, not English. Or they can speak English fluently, but they wanted someone who share their cultural background,
Yeah, for sure.
um, who understand Asian family dynamics.
Mm.
So that's very, very common.
Yeah, for sure. On that note, on family dynamics, then I think in previous chats we've had with you, you kind of mentioned seeing clients a lot about like parenting issues as well, and also like women's mental health and like postnatal mental health as well. Can you kind of talk more about those topics as well? Because I know like this topic of parenting is um, it's very popular in the Asian sort of community.
Yeah, I have two children,
Hmm.
so they are 7 and 4.
Hmm.
So I don't think I've had the lived experience of parenting an adolescent.
Yeah.
Although, from seeing many of the clients, I understand that's a whole pot of very conflicted feelings altogether.
Mm.
But I have had experiences going through two pregnancies. And then, when my firstborn arrived, I think I was focusing so much on how do I give birth
Mm.
um, smoothly. And I read so much about giving birth. I forgot that when the baby arrives, it's not the end,
Yeah,
but
this
now
it's
there's
just
a
the start. Yeah.
whole, how do I care about a baby when I had no prior experience?
Mm.
And I remember on the first day, my son just would not stop crying. So
Mm.
we ended up calling nurse on call because we were worried that he was actually unwell. And
Yeah.
then the next day, because we heard this funny snoring, we actually took him to the GP to
Hmm.
check. So this is, I guess, how anxious we were at parenting initially. Obviously, with
Mm.
the second child, we were more experienced, so everything was a bit more easy. But I think for first-time parent, I completely understand that postnatal adjustment, and in particular, I think in Asian culture, there's usually a family member who could be living in with the mom
Hmm.
as a second carer.
Yeah.
And that could actually cause extra stress and extra tension at the same time while offering a lot of practical support.
Mm.
And the thing with having a new child is it could trigger a lot of I mean, obviously biologically there are a lot of hormonal changes, there's a lack of sleep,
Mm.
but it could also trigger a lot of our attachment injuries.
Hmm.
This is a peak time where the new mother, or the new father um, would really need someone's nurturing and the support.
Yeah.
Uh, but often, when our parents or parents-in-law come to live with us, say it's not they don't want to, but they possibly aren't capable of the kind of nurture and support
Mm.
that we want. I mean, this definitely happened to me, and I had quite heated conflict with my own mother.
Hmm.
Um, so that adds another layer in our culture
Hmm.
uh, to possible mental health concerns.
Mm. Yeah. So when you say like attachment sort of injuries, like are you kind of referring to like because like the parent might have kind of like difficulties with attachment with their own parents, this kind of like bleeds into the relationship with the children when they are like sort of like taking care of them?
Yeah, so uh, to give you a very concrete, vivid example, so
Mm.
if you had uh, a mother who does not tolerate well crying,
Mm.
um, you know, possibly your mother rarely expresses sadness herself, does not like to talk about losses. And when you get sad and cry, she has certain reactions inhibiting you, or even sometimes, my clients tell me they get shamed. Then when your child becomes distressed, which at the first couple of years is very frequent, they
Mm.
haven't learned emotional regulation yet. And even little things could make them feel a profound sense of loss and fear, and they cry.
Mm, mm,
And then you're going to experience a lot of uh, irritation, frustration, sense of
yeah.
helplessness. And that triggers also a lot of anxiety in the body. So even
Mm,
though you could go read all the parenting books and teach you what to do, but that attachment injury means your body and your emotions just aren't at your direct control. And it's very
mm.
hard to do what the book says you're supposed to do.
Yeah, yeah,
Yeah.
yeah, yeah. So it's like more like a reactive kind of thing. It's hard to kind of resolve that if it's like kind of been the pattern in your family.
Yeah, and who's looking after this, all this bodily anxiety,
Mm,
all these urges that are coming up in your body? It's super uncomfortable. And if your family around you at that time happen to be judging you or being cold to you, rejecting, then you're really left alone with those body reactions.
mm.
When sometimes you really just need a soothing instead of someone telling you what's the right thing to do.
Yeah, no, definitely. I've also heard a lot from the community that like I think when people become parents themselves, they realize like how much the different kinds of parenting styles can have an impact on like your mental health and everything. So I guess like as a parent yourself, like I'm curious to see kind of your reflections on this, like whether or not like your process or like experience of becoming a parent kind of helps you reflect on like your parents and like what they were doing in your childhood.
Yeah, I constantly do. Me and my husband would sit down at the dinner and go, oh, let's reflect on today. Why did our kids trigger us so much?
Yeah.
And then my husband is usually like, oh, another lengthy conversation.
Yeah.
But yeah, I always, I think despite saying that and being a bit annoyed, he really understands the benefit of us just sitting there reflecting on how our parents, the way they interact with us, how that affect us and how we're
Mm,
doing things differently. I think it's very important as well, not just to go how I was affected by my parents in my own parenting, but how I'm actually consciously making a choice to do things differently
mm,
and celebrate that because that's something we really commend on each other on. Oh, our parents were like that, but now we're being a bit different in how we
mm,
treat. And but I also think about how some of my parenting worked. Um, um, I think maybe it's better if I'm talking a real example. So, for example, a lot of parents struggle with the whole lolly situation, sugar lolly situation.
mm,
But in fact, in my parenting, my parents never restricted me on any sugar intake. Um, but obviously, they're not gonna buy loads and loads of gummy bears to in the storage. It's just they buy, um, appropriate amount to be in the storage and give me the free choice. And
mhm.
in my adulthood, I never had an issue having that self-control or just have an inherent sense of how much sugar I need.
Yeah.
So we reflect on, oh, what did my parents to do well? And although sometimes we have this urge to go get involved, oh, you should only have one, not to have two. But I'm like, okay, is that really necessary? Now
Mm,
I ask myself that question. So I think it's important we don't just look at our parents from, oh, what they did wrong.
yeah. No, definitely. I think there are definitely a lot of strengths we can kind of pull from our parents as well, especially those like really unique cultural sort of values. And I think I really resonate with your story about like the lollies as well. Like thinking about my growing up, my parents also never really restricted me with lollies. I think I kind of learned to not have a lot of lollies just because my parents themselves don't really have a lot of it. So it's kind of like that modeling, like I don't know what you would call it, like positive kind of modeling of like good behaviors. Like I guess, yeah, there's so many ways that like parenting can kind of be done, I guess. But I guess a question a lot of people might have about Asian parenting is there are a lot of stereotypes like the tiger moms and all those more negative kind of stereotypes. Like, what do you think about, I guess, those kind of stereotypes? Like, do you think kind of this kind of so-called Asian kind of parenting style can be quite negative, or maybe it has like some kind of merits for emotional development as well?
This is this is actually a question that applies to all sorts of stereotypes because
Mm,
I don't think, if we're talking about therapy here, I don't think therapists from different cultures stereotype intentionally. But
mm-hmm,
if you haven't lived, felt the same kind of experience, you're going to need some system to
mm-hmm,
understand the line in front of you.
mm-hmm,
This is where I get friends tell me that, they go to see a Western therapist and they assume their parents have put a lot of academic pressure on them.
mm,
They're like, that wasn't me. My parents didn't care. They
yeah,
expected me to graduate early and not even continue studying, just to go into business. That's not me at all.
mm-hmm,
So I think it applies to all clients where I think, having that lived experience, it allows you the insight of contrast
mm-hmm,
and go, oh, that's different from what's typical. But you're not using that system to understand the client. But at the same time, there's a lot of implicit things that, the system doesn't capture. For example, a lot of East Asian clients don't talk very directly.
mm-hmm.
So when we keep saying, tell me more, tell me more, tell me more, what does that mean? What does that mean?
Yeah,
You irritate them.
yeah,
It's like I've already said it, even though I didn't say explicitly. Do you really have to for me to name it to understand that kind of feeling? But if you understand that kind of subtlety, that the culture of subtlety, then you might add in saying, look, the reason why I'm asking this is, because everyone experiences it differently. I just want to make sure. This all these little exchanges, they don't belong to that system because you've
mm-hmm.
lived and felt it. So it's more likely in the moment you're gonna automatically react because you have some implicit shared understanding.
Yeah, no, that's so true, actually. Like, that's actually kind of, I guess, the core of the culturally responsive practice, like being able to, I guess, have a therapist who understands your lived experience, but like not in the sense that um they're kind of imposing like stereotypes or like biases that like they learn from like social media or anything. And I guess this kind of leads into what you were mentioning is kind of leading into this next question I want to ask you about like communicating in therapy or even like teaching clients of like Asian background to communicate with their kind of family. Because I guess a lot of Asian people who seek therapy might kind of talk about difficulties in kind of communicating with their parents because of like cultural differences or like generation gaps. I'm wondering if this is kind of like a common concern you get in therapy and like what kind of advice you usually give these people.
Yeah, all the time actually. I think usually clients who arrive with symptoms, with a lot of distress, we often, address the distress first. But then when you peel the layers, there's always that interpersonal piece.
Mm,
Um, Whenever we talk about communication, I think we need to talk about expectation.
okay.
Because when you're talking to someone, when you're communicating with someone, you are hoping to achieve something.
Mm-hmm.
So I think that expectation is something when we dig deeper. It's definitely cultural relevant or specific to each family unit. Um, do everyone communicate want to achieve an outcome? Probably not, but that's often when the communication gets very messy. I might talking to you, treating you as my emotional garbage bin.
Mm-hmm.
Um, so I find it's useful for clients to understand the expectation of the person talking to them and understand their own expectation. So when they're communicating, they're conscious instead of automatically reacting.
Mm-hmm.
is that culture specific, perhaps in understanding that we use some cultural knowledge and lived experience, but I think this applies to all cultures. Um, what I have been talking to the team about, we discuss this a lot, is what's considered as mature communication.
Mm,
Because in the Western industrialized culture, maturity is seen as having good boundary, being assertive,
yeah.
you're independent, you don't rely on other people to regulate your feelings.
Mm,
Your autonomy is extremely important. Autonomous person is a mature person.
mm,
But can you parallelly can you move that parallel to Chinese culture? Probably not so. And I
mm,
have a feeling that's probably same as other Eastern Asian culture, including Indian culture. Because we really value group harmony.
mm,
We value achieving collectivist goals, not just individual goals. So from that sense, the maturity, the definition of maturity is most likely different from the Western industrialized version.
mm.
I think that's something we have to be aware of because a lot of psychological theories, like what is healthy development, is based
Yeah.
research and observation of the Western civilization and the
Mm,
modern ones. The modern ones, because psychology is something that really evolved in an industrialized society, being
yeah.
able to work, being able to make money, being productive. Um, but is that the only definition?
Definitely. I think you touched on some really important points about like, I guess, yeah, like this idea that psychology and like all the theories that have come about really kind of grew or like originated from a very Western kind of standpoint. So it is important, I guess, to kind of be critical about those models and like how we've kind of defined like communication and like healthy well-being and all of that. Um, I guess as a final question before I wrap up this interview is if you were to give one parenting tip as a psychologist, what would that be?
Um, yeah, so if I was to make it really simple, it would be about understand your inner truth
Hmm.
and tell the truth. I don't know if people will understand me here, but this is
Yeah, could you elaborate?
so um you know as as parents we can get into this trap of thinking how are we going to parent talk
Hmm.
in a way that shape the child into the way we want to shape them into.
Hmm.
Um, and being and understanding your inner truth is about understanding how each situation makes you feel. What are your own thoughts and feelings? And in an appropriate manner, being honest to your child. So again, with a real example, if you're worried about something, instead of saying, don't do it because it's for your good,
Hmm.
be honest that I look at you doing this, I am worried.
Mm,
And I know it's such a simple shift, but you're role modeling a child that your inner experience is valued. You
mm,
be honest with others about how you feel, how you think, and they learn in the process how to take perspectives and empathize.
mm,
And beyond all that, they have a real parent, a real human being, as opposed to an artificial trying to do the right thing, but then sometimes completely flip the other way around
mm.
version of you. If if that makes sense.
No, that makes so much sense. I think I've never thought of it like that as well. And like, well, obviously I'm not a parent, but I'm sure a lot of parents can learn from having that perspective. So I think that is an amazing parenting tip.
Great, great. Yeah, and I'm not saying this is easy to do.
Mm,
I'm still working on understanding my inner truth. It's a,
mhm.
constantly evolving forever journey, probably.
Yeah, definitely. Well, thank you so much for joining me today. And for anyone who's listening, like you can find Chen and the rest of the practitioners at Mind Body Heart Psychology on our Asian mental health practitioner list. But yeah, it was so nice to chat with you, Chen, and I'll see you another time.
Pleasure. Thank you so much, Marcus.
Thank you. Stop the recording.